Hello, world and universe. Welcome to the Trevor Donald Experience. Manifest your truth. And if you're new to the channel, please hit that like and subscribe button. And for all my continued followers, I want to say thank you. And this is an opinion-based video channel where I try to open your eyes and ears up to some of the travails and tribulations that take place throughout our cities, our states, our country, and sometimes around the world. And this particular story today is completely informational. And I really would hope that you all would take a clear listen to this video and please like and share it. There is going to be some great content here for you that is completely wrapped around the opioid crisis. And I've been wanting to do something on this for a long time. And when you hear me talk about some of the pillars that are destroying our country, untreated and undiagnosed mental health issues, the opioid crisis, and many times those go hand in hand where people are self-medicating with street drugs, and it is decimating our society as a whole each and every day. This story also is entangled with Medicaid and Medicare and access to health care. As we all know, mental health is always at the lowest point of the medical paradigm and is not taken seriously. The other part, many providers don't accept Medicaid, which is for low-income individuals. And then Medicare, of course, you're eligible for it when you're 65 and over. But you can also get Medicare if you have a disability, so Social Security disability for people under 65. And at least 1/4 to 1/3 of people that are on Social Security disability have a mental illness diagnosis as their disability. So that also limits them, where many providers don't accept Medicare and Medicaid due to their low payouts. This story also has everything to do with gaining access with this new advent in medicine called telemedicine. Which allows individuals to talk to a provider via telephone or computer to gain access to a healthcare provider. One of my very good friends out of Atlanta has a telemedicine company that you should take a look at. It's called Primo Health Partners. Dr. William Cooper, who's a cardiothoracic and vascular surgeon out of Atlanta, owns it, and he has a great telemedicine company. So with all that, let's get into this thing about this opioid crisis, where it started, how it has decimated our country, and there have been many people that have been affected by it. I've had friends of mine whose children or family members have been affected by this opioid crisis, and some of their children have even died. I have family members that are suffering from this opioid crisis also. So this story really touches my heart. So for example, let's go. In 2022, around 73,838 people in the United States died from a drug overdose that involved fentanyl. That was the highest number of fentanyl overdose deaths ever recorded in the United States, and a significant increase from the number of deaths reported in 2019. Fentanyl overdoses are now the driving force behind the opioid epidemic, accounting for the majority of overdose deaths in the United States. So how did we get to this place? And the number of drugs that are being trafficked through our borders, and fentanyl is the number one. But it goes back to a particular family called the Sacklers, who owned Purdue Pharma, and they pushed out Oxycontin at a heavy rate and dosage back in the 90s that many people say precipitated this epidemic. So, corporate accountability and public health, Sackler ruling and treatment gaps in the opioid crisis. So let's see how the Sackler family, who made billions of dollars off of this Oxycontin, and how the government has handled this. The U.S. Supreme Court's decision to strip the Sackler family of immunity from opioid-related lawsuits marks a pivotal moment in the fight for corporate accountability in the public health crisis, and this is a crisis. As the legal battle intensifies, a new report reveals a troubling gap in access to life-saving opioid treatment for vulnerable populations, highlighted the dual challenge seeking justice for the past while addressing urgent public health needs today. The pivotal 2024 Supreme Court decision overturned a bankruptcy court decision that granted the Sackler family, owners of Purdue Pharma, look that up, immunity from lawsuits related to the opioid crisis. The ruling, stemming from the Harrington versus Purdue Pharma case, could signal a significant shift in this dynamic, according to an article published by JAMA, Journal of American Medical Association. Meanwhile, a new report from the Office of the Inspector General, the OIG, remember these little acronyms, highlights the significant barriers for Medicare and Medicaid enrollees in accessing medications for opioid use disorder, called MOUD, M-O-U-D. So remember OIG, MOUD, which is medications for opioid use disorders. It's a real thing. While many populations aside from Medicare and Medicaid enrollees continue to be impacted by this crisis, the Supreme Court's action, paired with the newest data demonstrating the public impact, illustrates the legal potential in addressing the opioid crisis and the ongoing public health challenges of treatment access. As the United States continues to struggle with the opioid crisis, access to medications that treat opioid use disorder, MOUD, M-O-U-D, is essential to address the high rates of opioid use disorder and overdose mortality. Louis A. Day, team leader and social science research analyst for the Office of Evaluation and Inspection, said in a statement, Medicare and Medicaid play an important role in providing MOD, medications for opioid use disorder, but access concerns persist in both programs. For example, HHS, Health and Human Services, and OIG, the Office of the Inspector General, has found that hundreds of counties in high need of MOD services have had few or no MOD providers treating Medicare or Medicaid enrollees. They don't accept those insurances. And many enrollees with opioid use disorder did not receive MOD through their respective programs. So the Purdue Pharma and the Sackler family's role in the opioid crisis. In 1996, Purdue Pharma launched a strategy to promote OxyContin, an extended-release version of oxycodone, by aggressively marketing the drug and downplaying its addiction risk. Purdue fostered an environment that encouraged the overprescription of opioids, the JAMA authors wrote. The company more than doubled its sales force and funded over 20,000 educational programs aimed at physicians while misrepresenting the risk of addiction as less than 1%. OxyContin sales surged 2,300% between 1996 and 2000, by which time the drug had become a leading substance of abuse in the United States, fueling the opioid crisis and vaulting the Sackler family into the ranks of America's wealthiest. According to the article, as the opioid crisis worsened, Purdue and the Sacklers faced thousands of lawsuits. To evade liability, the Sacklers used two major strategies. First, after settling criminal charges with the federal government in 2007, they siphoned billions of dollars from Purdue into offshore accounts. Then, in 2019, Purdue declared bankruptcy, the company, Purdue Pharma, but the Sacklers themselves retained much of the fortune extracted from the company. Now, here's where the Supreme Court overturns Sackler's immunity. In 2021, the bankruptcy court approved a settlement that granted the Sacklers immunity from further lawsuits in exchange for a $6 billion payout. That's pay to play. Some of which was designed or designated for public health programs. However, critics argued that this deal allowed the Sacklers to escape full accountability while retaining billions of dollars, setting a dangerous precedent for corporate misconduct. On June 27, 2024, the Supreme Court overturned this immunity in a 5-4 decision, sending the case back to the bankruptcy court for renegotiation. The ruling emphasized that bankruptcy protections are intended for honest debtors who fully disclose their assets, not for individuals who attempted to shield billions in offshore accounts while avoiding liability for their actions. The Sacklers now face renewed litigation from individuals affected by opioid misuse, as well as state and local governments. They must either cut a consensual deal with plaintiffs or file for bankruptcy themselves. The authors emphasize that this decision significantly raises the stakes for the Sackler family and could set an important legal precedent for corporate accountability in public health crises. So what are the implications for public health and corporate accountability? The opioid crisis costs the U.S. between $50 billion and $600 billion annually, $600 billion, while the original $6 billion settlement was intended to provide some financial relief. The article cited prominent arguments that stated the price is insufficient compared with the scale of devastation caused by the crisis. The case illuminates how those in power who cause public health harm have used legal tactics, including bankruptcy, to dodge accountability from the U.S. legal system. Even as Harrington cuts off one mechanism for avoiding accountability, many others need to be addressed to establish legal safeguards against corporate misconduct that contributes to the brunt of the U.S. morbidity and mortality rate. As regional initiatives are regional initiatives enough to combat the opioid crisis? Despite the increasing prevalence of substance use disorders, particularly opioid use disorders, access to medication and treatment remains a steadfast barrier. Medical centers and healthcare networks are striving to mitigate these barriers in various pockets of the country, though many of the frontliners emphasize the urgent need for further progress. It goes on to say, in the interview with the American Journal of Managed Care, Michael Lynch, MD, Associate Professor of Emergency Medicine at the University of Pittsburgh, and attending emergency physician and medical toxicologist at the University of Pittsburgh's Medical Center, explained how his center has had success with telemedicine. Remember, I mentioned that earlier. In general, we know about 3/4 of people who have a substance use disorder don't receive any treatment at all. Fewer than a fifth of people with opioid use disorder actually receive medication treatment. Fewer than a fifth. 1/5, that's 20%. And a lot of the barriers are logistical. People don't know where to go. They have to wait. There are a lot of hoops to jump through to be able to get access for evidence-based care. While center-specific initiatives can alleviate harm reduction, there are societal and systemic barriers that play a large role in inhibiting access to care for the many Americans living with substance abuse disorders. There are a lot of stigma concerns. Transportation, childcare, work, you name it. Just lots of barriers. And those have always existed and continue to, Lynch said. What we found is that the telemedicine bridge clinic really helps to address those barriers, to at least help people get started and stabilize while we transition them to a longer term, maybe more traditional in-person or a hybrid model. These barriers still exist among populations that see physicians regularly and are insured. Unfortunately, when looking at marginalized communities like those with low or no income, without housing, or recently incarcerated, the gap to access widens, as does the possibility of encountering stigma from providers. The Center for Inclusion Health's Urban Health Outreach at Allegheny Health Network works to bridge gaps for those populations by bringing health care and education directly to the community. But according to Mary Sly, team lead of street medicine, urban health outreach, the inaccessibility of treatment extends beyond community-based care programs like these that strive to bridge these gaps. We really make an effort to promote destigmatized healthcare, whether it's substance use disorders or just providing care for folks experiencing homelessness or have been historically marginalized from their health from healthcare. She said, we really need to set up an example for our peers, but also to directly team with them and train our peers, because we shouldn't be the only people in the health system who take care of somebody who's homeless or helpless. We have failed if we're the only people who can do this work. So while the legal landscape surrounding the opioid crisis evolves and autonomous health initiatives aim to address it, the public health challenge persists, as does the urgency of ensuring access to treatment. The OIG, remember that's the Office of the Inspector General, report sheds light on critical gaps in access to MOD, M-O-U-D. Remember that's medications for opioid use disorder, particularly for Medicaid and Medicare enrollees. The finding reveals that 19% of counties lack any MOD provider. These providers don't take the insurance, while nearly 1/3 of counties have no providers who accept Medicaid or Medicare at all. This disparity is especially pronounced among office-based buprenorphine providers, many of whom do not serve these populations, even though most opioid treatment programs do. Additionally, administrative and financial challenges make it difficult for MOD providers to operate in high-need areas, further exacerbating treatment shortages. The OIG report provided several recommendations to improve access to MOD services. Geographically targeted efforts to increase the number of MOD providers in high-need counties, assessment of reimbursement rates to ensure that Medicare and Medicaid payments for MOD services are sufficient to attract and retain providers. And remember, that's what that means. These providers are not accepting Medicare and Medicaid because of low payments, so they're trying to increase the reimbursement rate to help these people with addiction issues. Also, it says establishment of a national directory of MOD providers to help individuals locate providers willing to treat Medicare and Medicaid enrollees. As the U.S. counties are here to grapple with the opioid crisis, the Harrington versus Purdue Pharma ruling marks a significant step toward holding corporate executives like the Sacklers accountable for their role in this public health disaster. Simultaneously, addressing the gaps in access to MOD, as highlighted in the OIG report, remains a critical public health priority. And finally, opioids come in many forms: Oxycontin, Percocet, Vicodin, codeine, hydrocodone, morphine, heroin, and of course, phenny. Here's some of the health effects of prolonged opioid use: depression, liver and heart disease, hepatitis C, HIV and AIDS, both through shared needles, brain damage, and death by overdose. Tell me what you think of this story on this opioid crisis, the relationship with the Sackler family, Purdue Pharma, and the inaccessibility of individuals on Medicare and Medicaid finding providers to help them through their mental in their addiction crisis. America needs to help these people.